Are we doing enough for patients with kidney cancer? Despite national guidelines clearly laying out recommendations for genetic counseling, in cases of early onset or bilateral renal cell carcinoma, RCC, the actual referral rates for genetic evaluations remain surprisingly low. This troubling trend has serious implications because understanding a patient's genetic background could significantly influence treatment decisions and help identify risks for other cancers. Recent research from Penn State College of Medicine sheds light on genetic counseling referrals for patients diagnosed with kidney cancer who fulfill the criteria for evaluation. By examining the medical records of 123 patients treated between 2017 and 2022, the study demonstrated that opportunities for critical genetic evaluations are being overlooked. What does the data reveal? According to the findings published in Urologic Oncology, only about 1/3 of these eligible patients received referrals for genetic counseling. However, among those who did receive referrals, an impressive 76% completed the counseling, with 84% of these individuals going on to undergo genetic testing. Among the tested patients, nearly 30% were found to have genetic mutations that might predispose them to cancer, including a significant 8% linked explicitly to kidney cancer, such as mutations in the von Hippel-Lindau, VHL, and fumarate hydratase genes. Why should we care about these findings? The presence of pathogenic genetic variants carries profound implications, not just for the affected patients, but also for their families. For instance, individuals with VHL are at risk not only for kidney cancer, but also for complications like pheochromocytomas, tumors of the adrenal gland, central nervous system tumors, and hemangioblastomas, blood vessel tumors. Identifying these variations can lead to better cancer screening and treatment options, such as targeted therapies available for hereditary kidney cancers. But how does this affect family members? Genetic evaluations can facilitate what's known as cascade testing. This process allows relatives of individuals with identified genetic predispositions to be tested as well, potentially catching cancers at a more manageable stage or even before they develop. Many genetic testing companies provide free testing for family members identified through these evaluations, which could play a critical role in early cancer detection. So what's holding us back? Despite the compelling evidence supporting genetic counseling, the study highlighted that only a small fraction of eligible kidney cancer patients were referred. There could be several reasons for this. Some urologists may lack awareness of the guidelines, while others might prioritize immediate clinical concerns over genetic discussions when delivering the cancer diagnosis. Additionally, patients themselves might decline referrals due to concerns regarding costs or challenges related to health literacy and logistical issues surrounding access to genetic counseling. Are there ways we can improve? Fortunately, there are ongoing national efforts aimed at addressing these barriers. Educational initiatives like instructional courses at conferences are being implemented to bolster urologists' understanding of genetic factors in cancers. Some medical practices are even utilizing electronic health records to flag patients who meet referral criteria automatically and applying innovative solutions like telehealth for genetic counseling, which could reduce waiting times. Looking forward, inspired by the findings of this study, future projects aim to delve deeper into the reasons behind under-referrals for genetic evaluations. Upcoming research will involve surveys targeting urologists and medical oncologists to gauge their knowledge and streamline referral processes, making it easier for patients to access genetic evaluation services. Ultimately, the vital takeaway from this research is straightforward. We are missing significant opportunities to enhance patient care. When patients are referred for genetic counseling, they are highly likely to follow through, and the insights gained from genetic testing can lead to personalized treatment plans and ultimately better outcomes. Addressing this disconnect in referrals could radically transform kidney cancer care, enabling earlier interventions and tailored therapies based on a patient's unique genetic makeup. What do you think? Is the medical community doing enough to uphold genetic evaluation standards? Or are there deeper systemic issues at play? Share your thoughts in the comments.